The subject of tonight's webinar is relationships first. So what does that mean in the context of government? What kind of change would we need to see to have governments that put relationships first? And don't we all do that already? To answer these questions and more, we have a great panel. Gill Callister is Vice President, Thought Leadership and Ethics and Integrity at ANZSOG. Gill has had a distinguished public service career here in Victoria. She's been Secretary of the Departments of Health and Human Services and of Education and Training. Brenton Caffin has also been a former Australian public servant. Brenton started his career at the Department of Prime Minister and Cabinet in Canberra. He then set up the Australian Centre for Social Innovation before going to Britain to work at the UK Innovation Foundation, Nesta. Brenton now leads States of Change, a non-profit dedicated to helping governments all around the world innovate. And Professor Donna Hall. Donna was CEO of Wigan Council in the UK for 8 years, and she led the Wigan deal, which we'll hear quite a bit about this evening. Donna was awarded a CBE in 2009 for innovation in public service, and she now leads the new local government network. Can you tell us about governments that you know of, that you've been involved with, who have put relationships first? And please tell us, what is the Wigan deal?
Yeah, the Wigan deal was a long-term social contract with residents, where we decided back in 2011 that we were going to completely remodel the role of a council in a place. We had to take about £160 million out of our budgets, and we were number 3 on the list of most cut councils in the UK out of 400. So we knew we had to do something radically different. And what we realised is that the assets that we didn't have any money, and we had to make massive savings, but the assets were the people of Wigan, 323,000 people, all very different, all with very differing needs. It's a very deprived place. And we wanted to enter into a new relationship with them. That's what the deal was all about, a relationship which was based on building up trust and being honest. Building up trust where the trust had been eroded a little bit between the state and the citizen. So we invested over £12 million in fantastic grassroots community projects. We froze tax, so people didn't have to pay any additional tax. And we asked people to work differently within their communities to help to support their neighbours, their relatives, their friends, to keep fit and well, to exercise more, to recycle more, to look after the environment, and to be kind of more active citizens volunteering in the local community. And as a result of that, after 8 years of doing it, and it's still going on now, we managed to make all the savings. We managed to increase resident satisfaction with local government by 59%. And we managed to do some brilliant things like increasing healthy life expectancy by 7 years in the most deprived areas. So it was a real long-term social contract. An example in the UK where a government has really seized a relationship first approach, which is not England, is Scotland. So Scotland are doing some remarkable things. And if people are interested in the Scottish Care Review, I think that's the best policy I've ever seen. It's all about children who are in care, and it starts with love. I've never seen a First Minister or a Prime Minister stand up in Parliament and talk about love so compellingly. So it's brilliant to hear Nicola Sturgeon do that.
How do things change though, Donna, for that to happen? What are the, I mean, you talk about the crisis that you faced, and clearly anyone who's looked at the Wigan example sees that it's inspiring, but what had to change at the national level? What relationships did you have to strike with national bodies? And is there a kind of mindset that needs to change, not just say in Wigan, which obviously you can pull it, you know, in some ways it's easier to pull a community together. It's not a super large place, but relationships at the national level need to change as well, don't they?
Yeah, they certainly do. I think it starts with inspection. So local government is very heavily inspected, and we live in a really centralised state in the UK. So lots of control, everything around funding, key performance indicators are set nationally and very and dictated down to us. So what we tried to work with our regulators, inspectors to do was to trust us, to get on with it. If we could deliver good outcomes outcomes, say for children in care or for making sure that people have great hospital care, let's work as a system within the NHS. So with our hospitals, with our doctors, with our mental health providers, with our housing providers, let's work in an integrated way. And we managed to get a really good agreement to do that from our inspectors. So we have a system called Ofsted, there's something called the Care Quality Commission. And once they could see that we were delivering good outcomes, they let us get on with it. But it isn't always the case. So the main thing for me is tight on values from a government perspective, but loose on delivery and trust and allowing people to get on with it.
Thanks, Donna. I want to come back to this a bit later, but Gill, I'd like to ask you, how does what Donna has just said resonate with you as a former secretary of 2 major departments here in Victoria? And can you give an example of something in your career where relationships have either been put first, or because they weren't put first, there was something failed to happen that should have happened?
Well, Donna touched on the Scottish Care Review and children in out-of-home care, and that is a really interesting example, because in all Western jurisdictions there is some form of public administration that takes on the care of children who, for whatever reason, of abuse and neglect, are no longer with their families. And if you think about a senior public servant who at law has a non-delegable duty of care for thousands of children, and of course then discharges those care obligations through multiple people and multiple service providers and multiple interactions, which that single person can't completely control themselves. That is a really interesting example of public administration that is taking over a very personal relationship, the relationship of a child and a parent, and then having to find a way to keep that notion of the relationship front and center, because it often quickly becomes a series of policies and procedures and regulatory issues and contracts and funding, and it's impossible for it not to be those things. But how do you keep that notion of there is a relationship that is important, that the state has taken on in someone's life? And so as Secretary of DHS in Victoria, certainly with the responsibility for thousands of children on any given day, I used to talk regularly to people about what it meant for their lives, all the various things that we were doing. Now, it's a clunky kind of conversation because of the magnitude of this, as I was saying, but unless you keep the notion in that particular example of the relationship central, you dehumanize the service and what's happening for children at the other end of it.
Look, can I just get in there and ask you, when you say you had conversations with, you mean you had conversations with clients or with providers, or
both? Conversations with clients, conversations with providers, conversations with my own staff who were delivering a lot of the delegated services. We invited clients to come and talk to us about their experience of what it was like to be receiving these services and be in this situation, to try and keep that line of sight between what we were responsible for doing and what the impact on people, particularly children, obviously in this case, children and young people, at the other end of it was.
It's really interesting. Brenton, can I ask you to put a conceptual frame on what you've just heard and also your own experience? What does it mean, in your view, for a government to put relationships first?
I think I might actually start with our personal experience as well, and maybe sort of broaden out from there to the sort of conceptual frame. And about a decade ago, when we set up the Australian Centre for Social Innovation, we, just also building on the care example, we were looking at the issue of trying to reduce the rate at which children were removed from families and placed into state care. And actually I'll talk about the process in a minute, but the result was actually developing a program called Family by Family, which actually sought to leverage relationships in helping people through tough times and out the other side. And this was quite atypical for a sort of government program, insofar as families actually helped us to design the policy and program response, and they actually helped us to co-produce the response. So in terms of what the sort of mechanism of change was, it wasn't a sort of paternalistic sort of government intervention. It was actually more of a facilitated relationship between families and their communities, and how they could actually be a sort of a support, a demonstrator, a role model, and a source of advice and support as they work through these challenges they were facing. I guess the sort of theoretical component there is, how do you recognize or re-evaluate the relationship between both the citizen and the state, and also citizens and one another? And how do we design policies in different ways to actually bring them more actively into the design and the production of these particular community outcomes that we're searching for?
How much do you think this is a function of the size of government, of the particular units that are delivering services?
Yeah, I think it's not so much size, but probably proximity. I think a lot of it is about how close you can get to sort of people and places. And sometimes the sort of higher up the food chain you go to, sort of like federal intervention and responses, state versus local, you tend to lose some of that sort of the connection on day to day with sort of families and individuals and communities. So I think the key thing there is how do you build proximity into your engagements, where particularly at that early stage where you are trying to genuinely understand what is happening in a situation and trying to test out different ways of helping to improve outcomes.
Yeah, Donna, let's pick this up. I mean, you started with two really inspiring examples, but it's true, isn't it, that most service delivery and the way most governments operate is not like the way you've described with the Scottish example and the example of Wigan. Why is that the case? And how do we get from where we are now to where you would like us to see in terms of governments that do put relationships first?
I'm not sure if everyone's read Radical Help by Hilary Cotton, but if you haven't, I really recommend you to read that. It basically goes through several examples, around 10 different case studies of why this doesn't happen internationally and why people don't put relationships first. All brilliant examples of things that Hilary's tried in countries across the world. But the very sad thing at the end of each chapter is that there's a sentence or a paragraph that says, and unfortunately the Commission has decided not to recommission this innovative project which was delivering fantastic outcomes. And I think it's because if we do it project by project, then it doesn't sink in. So what we tried to do in Wigan, and we successfully did, was we managed to kind of throw away the rule book that says you have to treat people as a unit of need. You treat people as an individual, as a human being, and it's a human to human relationship. So it's public servant, whether you're a police officer or a doctor or you're a midwife, you are relating to a human being, another human being. So we used an anthropologist, a brilliant anthropologist, to redesign and develop a kind of different conversations toolkit for every public servant working in the place. And we called it the Be Wigan experience. So we used anthropology basically to get people to have a blank mind and to listen differently to people on a one-to-one basis. And we learned so much about what was going wrong. We were spending 80% of our time on assessing people repeatedly, referring them through to different bits of the system, and instead of building a relationship with them. So we shifted that around. So we spent 80% of our time on the relationship, on getting to know a family or an individual, and then trying to work from there. We found the outcomes were amazing. And so we used Hilary Cotton's experiment in one of our social housing estates and just made it the way we worked every single day, every public servant across the place, relating differently. And what we found was that people really loved it and embraced it, because that was why they wanted to become a public servant in the first place, not to tick boxes and hide behind a clipboard.
So you think Hilary's examples work in big government departments as well as smaller sets of relationships?
I think obviously you can't have that one-to-one relationship, but you can have that relationship between place and government. where there is trust, where it's not a kind of autocratic relationship, where there's listening, where there's mutual support, where there's a reliance on local expertise. I mean, you can see now what's going wrong in England with the testing and tracing around COVID, where central diktats are being issued, apps are being created, but they're ignoring the local expertise on the ground within 400 different councils, and we're making a real pig's ear of it. So I do think, you know, governments need to listen to places, listen to expertise, and create that relationship of shared understanding and future purpose and shared direction.
Let's come back to that pig's ear in a moment, because I think it's a really important point you've raised there. But Gill, I'm really interested to hear from you. There's a great question here from Erica Bocoles, Erica, I hope I've got it right, who says, Gill, how do you maintain relationships in a large government juggernaut? I think it's a great question, because so many of us have worked in those very big departments. How do you do that?
I'm assuming the question's about how you maintain relationships with
people outside. Well, I guess I think people outside. You mentioned before clients. You mentioned providers. You said that was a priority for you. How did you manage to do that when you had so many other pressures on your time?
Well, you know, all my work's been in social policy and social service delivery and health service delivery. So even though we developed policy and programs, at the end of it is always a person who is receiving that. So in education, it's children and young people in the school system or in kindergarten or in the tertiary system. And there's interesting research about the fact that the thing that makes the single biggest difference to educational outcomes for children is the quality of the relationship. It's what goes on in a classroom between children and their teacher. And a lot of what goes on in a classroom between kids and their teacher is relational. And I mean relational in the broadest sense, not just we get on well and we really like Miss Scott and we really want her back next year. I mean, she or he creates an environment where children are open to learning. So you have to have teachers that know stuff and are across how to teach it, so have pedagogical capacity, but you can have, as we've all experienced, really smart teachers, but they can't really teach you. And so education is a relational service. It is a relational experience. It is not, and governments at this end are desperately wanting to lift Australia's NAPLAN results, lift the PISA results, compete better on STEM internationally. Some of that will be to do with knowledge and resources, but at the end of the day, most of it will come down to how teachers are able to create that environment, that relational environment in a classroom that brings out the most in kids, that gives them the greatest opportunity to learn. So if you can't, you know, it's so easy to get caught up, particularly in great big systems like education, in all the noise about latest policies and programs and measurement and outcomes, and those things are important. But if you can't persuade a school principal and a teacher to take notice of those things, to incorporate them into their practice, and then to learn to relate to students in an inclusive and diverse way that creates that environment for everyone to learn, then all of that's for naught. So I tried to push a lot of that to one side and say that's important, but if what happens down here is the most important thing, let's create a focus on that. So how do you do that? All sorts of kind of probably not rocket science ways. I would create ways for our senior team to visit schools and hold our meetings out in schools, to have presentations from students and teachers, to have small workshops with them. We created a student advisory group to the education department board because we had lots of stakeholder groups. You know, in education, there's no shortage of them. There's unions, there's parent groups, there's principal groups, there's teacher groups, there's all sorts of groups, but there wasn't a student group that we heard regularly from. And so we created a student group that could talk to us about their experience of school. Now, they're all, you know, they were 16 young people who are not going to be fully representative of the hundreds of thousands of students in Victoria, but they are a voice. They collapse all those layers of stuff in between, and they come into the boardroom and they are a voice to the people making the recommendations to government about our education system. And it humanises things, it grounds you in things, and it makes you think about those programs and policies you're working on, all that stuff we do in government, and what it's going to mean on the ground. Now, I know it sounds a lot like their last example, and there are other things I've done that were different to that, but if you are delivering what are essentially relational services, if you only focus on the technical side, and we do overly focus on the technical side in government, and it is not unimportant at all, but if you think the technical side will get you there, for most things, it won't.
It's interesting, Jill, and I'll ask Brenton to answer this after you as well. Sarah Hercombe has asked a question about, we've talked about social policy a bit in this discussion, but what about the hard-headed parts of government, treasuries, finance departments, the people who have their fingers on the purse strings? Are there examples that we know of, Jill, and then Brenton, of a relationships first approach being implemented within those central departments of government? And what would it mean if there were?
And it is hard. It is hard, Yaka, because it isn't as easily quantifiable as other programs might be in terms of inputs and outputs. The example I gave before, family by family, we were able after a couple of years to do a cost-benefit analysis of to try and turn some of the developmental outcomes we were seeing into sort of numbers that finance officials might recognise, and actually turned it into a reasonably healthy cost-benefit ratio of around, I think from memory, it's about $9 for every dollar we invested in the program. The state saved in direct fiscal costs, leaving aside the sort of longer-term sort of social and sort of educational outcomes. So once you start getting to those hard numbers, you can start to have a different conversation with them. But early days, and also just getting them to invest in this kind of way of working on principle is tricky. And you know, the key thing is to hoover up as many great examples like Wigan, you know, like the work that's happening across a number of London boroughs, where actually this has driven large-scale improvements in social and economic outcomes, and often far more effectively than a sort of a narrow sort of economic model might be.
But let's just maybe take Sarah's question a bit broader, Brenton, and let me ask you, what do you see as the biggest barriers to a more relationships first approach? Why is it seems obvious, right? But it's not happening. So it's not happening in a large scale way. So what are those barriers, and how can we address them?
Where to start? Bad habits, economic orthodoxy, reductionist thinking. We tend not to put a value on the relationship itself. How do we valorize that? How do we turn that into a number that finance officials can measure its effectiveness? It's a bit too ephemeral for that, and so therefore it becomes very woolly in terms of describing the effectiveness or the efficacy of these programs, and sometimes it just doesn't compute. So I think we need to tell more effective stories. We need to bring them to life. We need to engage people with the more motive side of the story, actually sort of bringing these people's stories actually to life. There's some great examples of this from the history books now, with the ATO bringing ethnography into their work in redesigning the tax system, and people like Ken Henry, who was a senior official at the time, being very moved by seeing some video footage of just how bad the tax system, how an impact it was having on people. So I think bringing these stories to life, shaking them out of just looking at the sort of spreadsheets and into actually looking into people's eyes.
Jill, what do you think about barriers? You've been right up there at the top. You talked about education before, but of course, as we can see across Australia, our education system is struggling if PISA results are any guide. What do you see as the barriers to getting a more strong relational approach in the ways you described before?
Well, I think it's about valuing the relational approach and being able to help develop it and emphasize it. I wouldn't want us to go off on a path of thinking you can change the world just with relationships. You know, there are clearly other conditions that have to be in place. You need good policies and you need resources and you need a number of structural things in place, particularly for vulnerable communities. The effect, it's more that we undervalue and underestimate the effect of then the relational component of transformational change and how important that is and how that can be pushed all the way back up through the policy process. So one of the really interesting examples at the moment, two quick examples, one overseas and one Australian, and I can't believe I'm going to get to be the first person tonight to mention New Zealand, but there you go. So the Ardern government is, you know, she is clearly a relational leader in so many ways, and we could talk about that a lot, you know, just the way she stood up and said when she was putting on the COVID restrictions, we're a team of 5 million and we're going to be a team of 5 million all the way through that. And you just felt like, I'm not even a New Zealander, I felt like I wanted to be on that team. But that government has a really interesting set of policies called their wellbeing policy and their wellbeing frameworks. And even the notion of a government talking to its citizens about well-being is a really interesting notion. It immediately becomes relational, because if you are talking to me about my well-being, there is an element of relationship in that discussion, even if it's about how I want you to improve various things for me personally. And that whole, it is a very, I've spent a bit of time over there understanding this and using it as a case study. And one of the most interesting things I discovered about the wellbeing framework in New Zealand is it is led out of Treasury. Now, I can't think of an Australian example where something that would be largely seen as about social policy would be led out of Treasury. But in fact, in New Zealand, it has a very strong economic underpinning. It's got lots of, you know, what you would expect to see components in it, big funding amounts for mental health, for children, for child poverty. But all of these things Treasury have looked at from the point of view of the economic health and well-being of the country, as well as the personal and social well-being of the country. And so when you're running, I took a group of deputy secretaries from all around Australia and New Zealand over there, a group of 26 or so, to do a case study on this as part of an ANZSOG course. And the people who came and framed day one for us were all deputy secretaries from Treasury and then Prime Minister and Cabinet. So you've got central agencies owning and prosecuting strongly the notion of well-being in many different forms. And it was really quite impressive. I think that is a great example. The other quick example we might want to pick up on, which isn't working as well but has the right intention, is of course the NDIS here in Australia, which is arguably the biggest social reform that we've seen in the last 50 years easily in Australia. And we are, you know, the idea of that is to have people with disabilities in control of the money that government gives them, able to work out how that should be spent, able to have it spent on things to improve their lives, not be locked into block funded programs in something called a welfare sector. Now, it's not working out operationally for a lot of people the way that it's intended, and we would hope that that changes and improves over time. And it's partly not working out because the intent of that relational model is being turned into a transactional and rationed one.
It's really interesting, Gill. Donna, I'd like to ask you about this. It's really interesting looking at your career trajectory. After those 8 years at Wigan, you've gone on to head up the new local government network. So that sounds like you're looking at ways to apply the lessons of Wigan more broadly. Is that right? And how is that going? I mean, because I think a theme that's emerging here is, you know, there are bright spots around the place, but how do we take those bright spots and make them wider and more uniform?
Yeah, absolutely. I think it is about systematising good practice in either in places or in projects. So Wigan, great example, but as others have said, there are some fantastic examples across the world, and we tried to just make it the way that we worked. We've got this thing in the new local government network called the community paradigm, which again you can just download it. It's free to download on the NLGN website, and basically it's arguing for a shift of power and control away from market paradigm, which we've had since the 80s, since Margaret Thatcher, where we outsourced everything. We thought that was the solution in the UK, and it didn't work. And we've had, obviously, for years and years, the state paradigm, where centralising everything, bringing it together under a state system was seen as the best way of working. And we're arguing now for a shift back to communities, back to relationships, listening to communities. Somebody's reminded me on the chat, which is, thank you for that, is that the Scottish Care Review is actually an independent care review and not a government care review. And I think that's really important. So 5,000 children and young people were engaged as part of the preparation of that review, and it was done independently. So I think the beauty of the Ardern government is she listens to other sectors, she listens really carefully and hard, and brings that good practice into government systems, which is what doesn't happen in the UK at the moment, and it does seem to be happening over where you are. So fantastic. I also want to work for the Ardern government. So it is a definite, and having it driven by Treasury, how amazing is that? But it's so common sense, because it does save money. Hillary's examples in Radical Help pinpoint the fact we were spending £500,000 on one family, £500,000 a year on one family. And at the end of the year, they were in a worse position than they were at the beginning of the year. But we didn't change our... Yeah,
it's about efficiency as well. It's about efficiency as well as quality and human connection, right? And
absolutely, yeah. It's cheaper, it's better. You have much better outcomes. People are happier, weller. And so for me, it is about ethnography. It's about anthropology. It's about the study of human beings, the study of society, relationships, communities, cultures. And they eat strategy and policy for breakfast. But you have to embed them into strategy and policy, which is the hard bit. Keep it really simple. Don't make it too complicated. So much policy and strategy I see is far too complex, and people just don't get it. So kind of keeping it really simple, really real, and applying it to everything that you do.
Sorry, Donna, to cut across you, but how do we measure it? There's surely a question governments, are very hooked on measurement, as you know, and for understandable reasons. So did you think about that whilst you're at Wigan and then subsequently?
Yeah, we did. We tried to develop an outcomes framework, strategic outcomes framework, which was based on things like the reduction in poverty gap, as I said before, the extension of healthy life expectancy in our more deprived areas, educational attainment in groups where there were very poor attainment previously. And we kind of relentlessly pursued that. What tends to happen is we develop pathways and policies and then populate it with people who just follow the pathway rather than connecting with the person. So we kind of turned that on its head, really, and subverted those pathways by placing the value of relationships. I'll give you a practical example. One of the things we did, can I just quickly mention two quick examples? One health example where we had one guy who was visiting our accident and emergency department every single day, 365 days a year. But because we were hitting every target, we were seeing him within 4 hours, he wasn't on anybody's radar. Nobody had a conversation with him about why. So KPIs don't work in practice. They cost more. and you have to subvert them and change the way that you work.
And you're going to give a quick second example, I think.
I've forgotten. It's too early in the morning.
Maybe I'll jump in there quickly, James, just to build on that. Only because Donna can't remember a second example. And that's actually the use of social prescription as a model in the UK quite a lot these days. So actually recognizing that maybe what people need for for their health and well-being, isn't just medical treatment and isn't just therapeutical regimes, but it's also connection to community. And so one of the things that the NHS has been promoting for several years now is this idea of social prescribing. So actually encouraging people to, whether it's take up sport, join community groups and other things, reading clubs and so on, and recognizing that these may be just as beneficial to the improvement in the sort of the patients or the people in their care. So I think that's an example of sort of, I guess, valuing relationships as a transformative element in people's lives.
Thanks very much, Brenton. Well, we're going to break into groups now. Welcome back, everybody. And I hope you had a great session in your chat room. We had a terrific session in mine. I was talking with two public servants from Queensland, and we talked about some of the pressures that governments face, which was really interesting. And the sense that the public sees government as large and powerful, which it is, and themselves as small, but also within government, people feel a lot of vulnerability. They are very conscious. They're conscious of how the media might address a particular policy area. And Queensland is looking at voluntary assisted dying legislation, for example. It's an extremely contentious area, and there's a lot of caution and unease about venturing in. And you can see the influence of risk on government thinking. And I wonder, Brenton, whether you think, in terms of the barriers to making this sort of radical change that might lead to a more relationships first approach, that the question of risk comes into it a great deal, particularly in a more polarized time. We're all very shouty on social media. The two public servants I spoke with talked about how there just seemed to be so much more polarization, so much more quickly government decisions were torn apart on social media if they're perceived to be wrong. And I'm interested in your thoughts on the role of the climate we're in at the moment, the sort of tribal polarized climate, on trying to make these changes within government.
Wow.
Just an easy one to get us started.
Yeah, absolutely. Look, I'm not really sure. Can I almost disagree, like ignore that, but answer a slightly different question, and maybe the answer might emerge from that. Because we had an interesting conversation in our group about, and I was reflecting on. So I mentioned we've just been running a learning festival for the last 3 weeks, and we started with a presentation from Tyson Yunkaporta, who's the author of Sand Talk. And if you haven't heard of that book, I highly recommend you read it. It's about how Indigenous thinking can help save the world. And in his talk, and I put the link to his talk in the notes when I stopped talking, but one of the things he talked about is how from an Indigenous perspective, you approach community, you go into community. And for them, it starts with respect. It moves then on to connect, which is sort of, so you start with the spirit, you connect with the heart, you then reflect, and you start to then move into your head. And only then, when you've got a sort of an understanding of the sort of the context, do you then start to direct with your hands. And the sort of Western model is almost the reverse of that. We tend to go into community and start sort of like directing and saying what needs to happen. Our evaluation mindset then sort of starts to measure how much of a mess we've made and whether we ought to have done things differently. And then over time, we start to build a deeper understanding of this community, and then we start to connect with them. And as he says, it's only when they get on the plane to fly out and they're like, oh, I'm really going to miss you guys. I have this sort of real strong sense of respect for this place, that they only get that right at the very end. So we talked about how you reverse the investment of resources to spend more time genuinely understanding place and community before you then start to sort of draw up strategies and policies and programs. And so I guess this is my roundabout way of answering the question. My gut tells me that that ultimately is a lower risk model, because if you're designing things once you've got a deep-rooted sense of the context, it's probably more likely to land, and it's probably more likely to resonate with the people you're engaging with, and it's therefore less likely to result in a very badly designed policy at a desk in Canberra that then needs to be kind of sort of glossed over or made to look good in press releases or PMQs. So if you're asking me, I think this is ultimately a lower risk way of doing it, because you're putting in the spade work to really build those relationships and understand context. I got to your answer, I think, at the end, I hope.
No, it's good, Brenton. And it makes me think of Donna's work at Wigan. Donna, one of the things that struck me was, correct me if I'm wrong, but it seems that you started with the idea, rather than saying, what can I do for you? What do we all need? Seems to be, and tell us about that start with the people of Wigan, those first conversations, and how you got to a decision about where to go.
Yeah, I mean, previously we were quite a top-down paternalistic organisation, very much a kind of we will do things for you and you will appreciate it. Very strong Labour controlled, always had been Labour controlled, but not really connecting with people, and quite complacent and paternalistic. So one of the first things we did was admit when we got things wrong and say very openly, we're sorry, we got this wrong. And it took a little bit of time for me to persuade the politicians that was a good thing to do because of the risks attached to it. But ultimately they gained a lot more respect from the public for admitting when you got things wrong, which you can see at the moment with the UK government isn't happening. So 60,000 deaths, more than 60,000 deaths. And we are world beating according to politicians at the moment. And people can see that that's ridiculous and it's not helping them on social media or on the opinion polls. So I think honesty and encouraging politicians to be honest and upfront, and and then move into policies and public servants. You've got some incredible assets, building on the assets you've got, communities, families, businesses, and people, and building on them and seeing the strengths in every single individual, having strengths-based conversations with them. Cormac Russell, I don't know if you've come across his work, but he's just written a fantastic book about how public servants should enter community spaces. And it's really worth, if you're interested in this stuff, it's only been out a couple of weeks, but it's fantastic. Really does give you a great and practical insight into how to make it happen. Can
you just state the name of that book again, Donna?
It's called, I think it's called Entering Community Spaces, but it's by a guy, if you just Google him, Cormac Russell, Cormac Russell, and he's brilliant. He does some great work in the UK.
You've raised a really interesting point though about the COVID situation. If the Prime Minister of the UK had stood up and said, we made a mistake, he would have been destroyed, surely. In a way, it might be easier to say in Wigan, we got things wrong for you, than it is to stand up nationally and say, we got this wrong. Do you agree?
No, I don't agree. I think humility is being really sadly lacking in our response in England, not in Scotland, Ireland and Wales, where they seem to have got it right. I think there's a lot of strength in humility, and what we've seen is a lot of hubris and bravado, but people can see through that. People are being treated like children and it's quite offensive. So, I think they've made it worse for themselves by pretending that we are something that we're not. And I think they would gain a lot more respect if they said they got it wrong. So you've probably seen the Marcus Rashford footballer, Manchester United footballer, who's managed to persuade them to do a U-turn. But even then, they didn't say on school meals, free school meals over the summer. So you've got a 22-year-old footballer who's managed to have more influence on the government than anybody else. And, they didn't even say thank you to him. I'm really sorry, we got it wrong. And that was a great opportunity to do it. And I know I speak to a lot of people on all political spectrums, and they do think we are heading for a massive disaster with a no-deal Brexit and the kind of hubristic approach of this government.
Gill, do you think it's what Donna says is very interesting, because she's driving down to some core human behaviours within government, and particularly the ones that are so hard to do. For example, saying we got this wrong. In your experience, is it possible for ministers and for secretaries to stand up and say, we got this wrong, we need to start again? Have you seen that? Is it possible?
Well, you know, it's interesting. I think it was only this week in the Parliament that the Prime Minister, the Australian Prime Minister, said we got it wrong with robo-debt, and apologised. If I was, you know, being cynical, that's after an awful lot of public pressure, media pressure, and now I think a legal class action. So you kind of wonder if that had happened a little bit earlier, because the stories that were coming out about the impact on people of the robo-debt, even before the decision about it, I think being illegal, were pretty awful human stories of impacts in people's lives. And there was a sort of relentless refusal politically to acknowledge any of that other than a little bit case by case. So other than that, not acknowledge that the whole system was wrong. So it's interesting, we saw that, I think, this week, but I think probably saw it too late. I think you can say you've got it wrong. It's very dependent on how wrong and what the consequence of that was, and how early you acknowledge that something was wrong. And it's really important that you explain how you're then going to fix it, what you're going to do differently. Otherwise, I think what happens is with this, you know, we have a lot of scrutiny bodies of public delivery and public policy, all the integrity bodies, the anti-corruption commissions, the ombudsman, the auditor general, all of which play a really important part in our integrity architecture. And I wouldn't for a minute say they're not important, but we have grown the commissioners and the specialist ombudsman and other positions to scrutinise the public service in a way, I think, because there is a huge aversion to the risk of getting it wrong, and acknowledging that early. I think it's very dependent on a number of factors.
Thanks, Jill.
Can I build on that, James? I mean, because I think, you know, we shouldn't be looking at these things in isolation. I mean, one of the relationships we ought to be talking about is the ongoing relationship between elected leaders and citizens, and these are cumulative, right? It's not just how, you know, the Prime Minister behaved on robo-debt. That comes after his behaviour during COVID, and that comes after his behaviour during the bushfires. And so I think the really interesting question for elected leaders is, how do they show up in a way that is authentic, that is candid, that is humble? And I suspect that the more, and we've mentioned Jacinda Ardern a number of times on this call, but I think the more consistently you can present yourself, and the more you can bring people into your thinking, the more confidence people have that you're trying to do the best you can in a given situation. And so when things do go wrong, which they will inevitably do, people are more likely to look charitably, or at least understand that, you know, these things happen, and are willing to listen to your explanation of what happened. And so I think, so part of this is about, how do you build up that muscle of engaging more authentically, rather than sort of trotting it out, you know, just when you're on the back foot and there's a class action pending.
Let me, one thing that's coming up, let me ask you this, Donna, is people are very interested in the idea of government getting closer to citizens. How is that squared with issues that government has to consider, which is probity of its activities and fairness, you know, so that the resources are distributed fairly? Do you see a tension between proximity to citizens and those other imperatives of government?
No, I don't see a tension. I think it's critical. I think the issues that we see now in the UK are a complete disconnection from how people really live their lives, and engagement with a very small group of very privileged, usually white people who don't reflect the makeup of society. And I think the way that they're conducting themselves reflects that in their policies and in the way that they are issuing centralised diktats without understanding what's actually the strength of feeling of people. So I think it's really important that the engagement is at the heart of every single politician, whether they're a government politician or a locally elected politician. They are there as public servants to serve the public. And I think sometimes people forget that. And they listen to a very small number of people who are in similar social circles to them.
Donna, stay with me. I'm going to ask each of you one by one to sum up. We're 4 minutes from the end of our webinar, and I'd like each of you in a minute just to provide a final reflection on the discussion we've had tonight. Donna, I'm going to start with you.
Okay, well, thank you for doing this. I think it's brilliant, and we need to talk more about relationships at the heart of public policy. Yeah. Thank you.
So what are your thoughts? Give us one takeaway from this, from your own experience, if you would.
Be bolder in writing relationships into public policy. I've remembered my other example now, which is about not writing love into policies. So Kathy's on this call and she knows about this, but basically we had a real problem with homelessness in Wigan, and we designed some amazing policies which didn't think about the relationships that homeless people had. And the main relationship that a lot of them had was with their dog. So they didn't have any family. They'd lost a lot of their friends and family because of alcohol and drugs. The one thing in their life was a dog, and we couldn't accommodate the dog in the housing that we provided. So they stayed on the streets, but we hadn't talked to them. We didn't understand the power of the love and the relationship between the dog and the person. So that's why love is important.
That's a brilliant example. Thank you. Brenton.
So I guess my takeaway is, I agree, I know you didn't want violent agreement, but I agree with everything that Donna has just said. For me, I think presumably if you're on this call, you probably believe at some level of the importance of this. I think the question is, how do we embed this and integrate this into the way that we design policy, the way that we deliver services, and the way that ultimately we serve citizens. And so, I guess my key sort of takeaway point for people is, keep looking for ways that we can embed this way of working. And, to take Tyson's point, invest up front in building those relationships and understanding communities and context before, designing from behind your desk a long way away.
Thanks, Brenton. Gill, can I ask you to leave us with one last thought on this subject?
I saw a really interesting presentation earlier this year at a conference on medical regulation of all things. And the question that was asked was, is there an association between disrespect and outcomes of care? And it was essentially going to that issue of, you might see a surgeon who is technically brilliant and they're really rude, but you don't care that they're rude because you're getting the best technical surgeon. And this study, and there's been a number of studies on this, was looking at, is there a relationship between the outcomes that surgeon gets if they are a particularly rude person? And interestingly, the answer is yes, there is a relationship, and it's a negative relationship, and it's statistically significant. And I haven't got time to go through all the detail about it, but essentially, when you have a negative relationship with someone who is providing you with healthcare, you are less likely to tell them things. You are less likely to seek additional help or information from them. And they are in turn compromised in the way they treat you because they don't know everything. So the thought, taking that notion to scale, because a lot of what we do in government is the technical. It's building the technical programs and policies that we're going to push out to places. Is there an association between disrespect or an absence of respect? They're not the same thing. And the outcomes and performance of those policies and programs.
Thanks, Gill. That's a really good thought for us to finish with. There's a thought here from one of the people in the chat who says we need to convince the unlike-minded. So I guess a challenge for all of us is how we take these thoughts out to people who may not agree with us. And that's something we might come back to in these sessions. Picking up your point, Donna, to conclude, I want to make a plea for plain language in government. I think that makes a difference. I think if you write letters that sound like human beings, actually in writing the letter as a public servant, I remember reading about someone in New South Wales in Australia who'd taken a public servant who'd taken a plain writing course and said, I now see the people I'm writing letters to as human beings because I'm forced to speak to them as human beings. So that might be a simple thing we can take away. As one of our people in the chat said, can I please not be called an end user? And so let's try and avoid that kind of language. So thank you very much to everybody for coming tonight, and particularly thank you to our panelists, to Donna Hall, Brenton, Caffin, and Gill Callister. See you in 2 weeks' time. Thank you.